Okay, so these are my 4 most common exercises for tennis elbow or golfer's elbow, also known as lateral epicondylitis or medial epicondylitis, or in the case of this blog, we're talking about shooter's elbow for shooters that have pain when they're shooting, which would be either or. But it doesn't really matter, I do largely the same exercises for each of them. So what I start off with is a dumbbell curl to kind of warm up the joint, okay? And I'll do 3 sets of 15 reps. I'll do it with an easy weight, a medium weight, and then a harder weight. And if you can do 15 reps with good form on the 3rd set, then the next time I move up. But I want to see the twisting down here. I want to be able to have what's called supination coming up at the top. So I'm getting a little more motion at the elbow, and I think if I was to go down and keep it extended, that might be more irritating to people's elbows, especially if they have some bone spurs in there. So I want to have my thumbs kind of facing forward, and then I twist it as I come up. And if I have pain on the inside of my elbow right there, it might hurt a little bit when I do that, but I'm going to kind of ignore it. Then for triceps, I use, in the clinic I often use my Tricep kickback machine, but if you're trying to do it at home, I would use dumbbells, and I would lay on the floor or lay on some kind of bench. And I would do the exercise thusly. And it's typical for people to do like a tricep extension when they're laying down with their palms up, which is not incorrect. But doing it with the palms up manner is going to be working more forearm flexors as a stabilizer, which I'm already hitting when I'm doing the curls. But if I do them with my palms in like this as I'm coming down, it's going to be working my wrist extensors, which is what I want to hit if I have the tennis elbow or the pain here. So I'm like that. I turn my palms in that way as far as is comfortable. It's not quite 90. And come down to where I almost hit my head and extend it up. And I would do that for 3 sets of 15 reps. Okay, and then, so those are kind of my warm-ups and my overall strengthening, but they are also hitting the forearms with those methods. And then I go into my wrist curls, which is hitting the muscles right here and would be strengthening that tendon right there. So I would be going down to my fingertips as far as I can, so I'm trying to stretch out the joint a little bit at the bottom, and then coming up. And I would do this for 3 sets of 15 with, in this case, I'm holding 10 pounds. So my next set would be with 12 or 15 pounds, and my 3rd set would be with probably 20 pounds. I know how much weight my bad arm should do by kind of how much my good arm might be able to do. And I'm trying to make both of them stronger. So I like to train both sides. Ideally, I'm trying to get the bad arm stronger than the good arm was before I started working out on it. And then I know it's still pretty healthy and strong. The last exercise, so this is, if you have pain here, this is kind of your money exercise. This is the one that you're really trying to hit, and I would try to hit it daily. 3 sets of 15 daily to hit that tendon. If my pain is here, for the lateral epicondylitis right there, the exercise that's really hitting that is this one. I like to tend to go up on my toes so I don't hunch my back as much. And I go, and if I do this, I kind of want to hunch my back more too. So I let people get away with having their arms straight like that and doing that motion there. And this I would do for 3 sets of 15. If you have one dumbbell, you can do one side and then do the other side, or you can do them both the same. I do like to work both. I want to get both of them strong, and you can kind of know at least what normal should be by looking at the good side. Alternate ways to do it. So this is how I've done it for years, and this is probably how most people will have to do it at home. Either way, on a raised up platform. This is why I can keep people's backs and their necks in good shape. And I can do it this way and really work on my forearm flexors, targeting that tendon right there and these muscles and the extensors. And because I'm keeping my hand flat versus like when I was on my knees like this way is a lot harder. So you'll get away with less weights doing it that way. but I'm hitting my wrist extensors there, and 10 pounds is getting me a decent burn. I think if you do it with 2 pounds or 3 pounds, it's just not going to get you anywhere. For wrist flexors, really strong is probably 20-25 pounds. For wrist extensors, strong and healthy is probably 10 pounds starting, working up to 15-20 pounds or so, and that would be pretty hard. For a woman, this way they can usually do 15 pounds or so, and probably this way they're probably doing 10-12 pounds, maybe working up to 8 to 10 probably, but I wouldn't do any artificial limitations because everyone just works up to what they can. And if on the third set you're able to get 15 and the form looks good, then next time go heavier. It'll only get better if you work it up heavier. If you stay with the same light weights, the pain stays pretty much forever.